Okay.
Hi, and welcome to today's webinar put on by Sutter Health, Memorial Medical Center, and Community Hospice. Today's topic is it COVID or the flu? What an important topic, especially with the pandemic going on and it's flu season. And I know there's a lot of people that have a lot of questions. So very interesting topic, and we're excited to share some information with you today. I'd like to start by letting you know that we're using a different format this time, and so this is a meeting and not a webinar. So you will see other participants' faces that have joined us. If you are joining us throughout this session and you do not want your face shown, please just at the bottom of your screen, hover over the camera option and you can turn that off there. We will be recording this webinar and we will be showing it on social media, as well as sharing it on our website platforms for others to view at another time. With that, I'd like to introduce our speaker. Today is Karen Dessy. Karen Dessy is our clinical educator here at Community Hospice and has been working specifically with all of our COVID relief. And so she will be a wealth of information. And again, if you have any questions at all throughout this period of time that we're with you, please go ahead and enter them into the chat field. We'll address all your questions at the end of today's presentation. Karen, I'll pass it over to you at this time. Thank you.
Thank you so much, Kristen. Hello, everybody. Hope you are all staying well. And like Kristen says, this is a very important topic. We're in the middle of flu season, and then we're in the middle of a pandemic with symptoms that are very, very similar. So how do we decipher them? Well, let's see. What is the difference between the flu or influenza and COVID? They're both very contagious respiratory illnesses, but they also they are caused by different viruses, right? There's a different strand for each one. The COVID-19 virus is caused by an infection with a new coronavirus, which is called SARS-CoV-2. So if you see that somewhere, that usually represents a COVID strain. And the flu is caused by an infection with the influenza virus. COVID-19 seems to spread more easily than flu and causes more serious illnesses in some people. It can also take a long time before the symptoms start to show in people, and people can be contagious for a longer period of time. Because some of the symptoms of flu and COVID are similar, it may be hard to tell the difference between them based on symptoms alone. So testing is definitely needed to help confirm what the diagnosis is. And we do have tests available now for both COVID-19 and for the flu. So if you're having symptoms and you really feel that you need to decipher which one it is, it's a good idea to call your doctor and then they can set you up with a test. COVID-19 and flu continued. Really don't need to read the heading, but both COVID-19 and the flu can have varying degrees of signs and symptoms, ranging from no symptoms at all to really severe symptoms. Some common symptoms of COVID-19 and flu are fever and feeling feverish with chills, a cough, shortness of breath or having difficulty in breathing, fatigue, definitely wears you out, having a sore throat, a runny nose or a stuffy nose, muscle pain or body aches, a headache, and some people may have vomiting and diarrhea, which is also common, but more common in children than adults. The flu virus can cause mild to severe illness, including common signs and symptoms, as we just talked about. And COVID-19 seems to cause more serious illness in some people. Other signs and symptoms of COVID, which are different from the flu, may include a loss in taste or smell. And sometimes you don't lose your taste completely, but things start to taste different. And your smell doesn't completely go away, but your normal smells don't smell normal. So there's a definite change in what you smell and how you smell them. So let's talk a little bit more about the flu. Flu is caused by infection with influenza virus. Most people who get the flu will recover usually. You get the flu, you get the symptoms, and within a few days or so, you start to feel a little better, and it takes at least 2 weeks to fully recover from this. Some people have to go through the whole 2-week course of feeling ill. Some people, it gets better a little bit sooner. Some people will develop complications, such as pneumonia, as a result of the flu, which can be life-threatening and result in death. So seeking medical help is really, really important. If you don't feel well, if you're noticing that your breathing has changed, if you're noticing that the cough is getting wetter and deeper and it seems to be more difficult, please seek out help. Some general symptoms this time of year, it is colder weather, and covering up and keeping warm around the chest area is so important. Sometimes we see the sun come out, we're like, yay, let's just go out. And we think that just a t-shirt is okay to go out in. It's always a good idea to take a light sweater just to stay warm. We're just more susceptible than we realize. Some emergency warning signs of flu, especially in children, is fast breathing or having trouble breathing. If their lips start to turn blue or the face starts to turn blue, if you notice that their ribs are pulling with each breath, right? They're really using all of their chest muscles. That's definitely an issue. If they complain of any kind of chest pain, severe muscle pain, or children can't always express it. So if they refuse to walk, or if they don't want to move very much, and your children don't easily give in to sickness. So if they're having those issues, you know that there is definitely a problem. Dehydration. If you have no urine for 8 hours or dry mouth, no tears when crying, if you notice that in children, you definitely need to seek out medical help. Not interacting when awake. If they're not alert, if their eyes are glazed over, that's definitely a severe sign. Some children will have seizures, which might be out of their norm. And children that already have a disease that causes seizures, this may become worsened and more frequent seizures may occur. Fever above 104. This, if it's happening for a prolonged period of time, if it lasts for days and days and days, can lead to seizure activity. So giving children really tepid baths. You don't want to give anybody a cold bath that's going to cause more problems, but a tepid, very, very lukewarm room temperature bath just to cool their bodies down is really important. Cool compresses perhaps between their armpits and around their groin area to keep cooler blood circulating. That's usually really helpful too. In children less than 12 weeks, in less than 12 weeks of age, any fever is going to be a problem. Fever or cough that improve but then return or worsen, that definitely warrants seeking out medical help and worsening of any chronic medical condition. It's hard to say that children get sick, but we have more and more children that are born with certain sicknesses and diseases, and anything that increases that disease getting worse is definitely something that you need to seek out help for. Any questions, thoughts, or concerns at this particular point in time?
No.
Okay. Anything that warrants considering an emergency care, definitely having shortness of breath, which is worsening, or difficulty breathing that is worsening, persistent pain or pressure in the chest or the abdomen, persistent dizziness, confusion, inability to awaken, seizures, not urinating is not a normal thing. That's definitely severe dehydration, which means that the patient, if they're drinking and are not urinating, they're holding onto the fluid somewhere, or they're just not drinking because they're not alert enough to take any fluids in. 1 to 2 days when you're feeling not well, just barely taking a sip here and there, that's kind of normal. Beyond that, you really want to seek some help, okay? When you're at home and you're trying to manage some of these things, really do good oral care, a swab with water, just, keeping that mouth moist as possible. That'll absorb a little bit, but it's still, you want to seek out some medical assistance in that. Severe weakness and unsteadiness, fever or cough that improves, but then again returns and worsens, and worsening of any chronic medical condition. Anytime you know that things are getting worse or feel like they're getting worse, and it's probably a good idea to seek medical help. Okay, so is it a cold or is it a flu? Because the cold season is also upon us, right? So how do we really determine which is which? Well, some of the signs and symptoms of a cold, you might get the symptoms that start are gradual, right? You get a little bit of a headache, and then you get a little bit of a stuffy nose, and then it starts to run. And I don't know how it is for you guys, but usually one nostril gets plugged out, one nostril is running, and then it switches sides. And I have this phlegmy cough and a little bit of body aches and a little bit of a headache, and medication usually helps to clear some of that out. But the flu, it can hit you suddenly. It doesn't necessarily have this like a little symptom here that slowly builds up. It just, one day you just wake up feeling really, really bad, everything hurts, and you just don't feel well. And then, as the day progresses, you have a fever, and it's just everything happens suddenly. The fever in a cold is very rare, but in the flu, it is a usual thing that happens. Aches. In a cold, you might have slight body aches, but you can get around and still function. The flu, it's usual to have body aches, and it tends to keep you in bed more often than not. In a cold, in the flu, you will have chills, but in a cold, it's rare to have chills. Fatigue and weakness in a cold sometimes, usual for the flu. Sneezing is very common in a cold. And you may sometimes have sneezing in a flu. You may have a combination of both, but it doesn't happen often when you have flu that you would be sneezing. Chest discomfort and cough. You might have mild to moderate coughing and chest discomfort when you have a cold, but it is very common when you have the flu. A stuffy nose is common when you have a cold. You rarely, but may sometimes have a stuffy nose when you have the flu. Sore throat is common in a cold and sometimes common in the flu. Headaches, usually, unless you have a head cold particularly, it's rare to get a headache when you get a cold, but it is very common to have a headache when you have the flu. Any questions or concerns about any of those things?
Karen, there were a couple of comments if you want me to chime in.
Sure, absolutely.
Okay, so the comments were, somebody had a physician tell them that it was important to gargle daily with either salt water or mouthwash as the bacteria can collect in the throat.
Absolutely. That is a very good idea, actually. At this time of season, and this season, and under the current circumstances that we're in, it's a really good idea to do goggles in the morning and in the evening, or if you feel like you might be getting a bit of a sore throat or a collection of phlegm in the back of your throat, it's a good way to clear it out.
Okay. And then one additional comment that flu-like symptoms in adults also sounds like a UTI.
It can be that way. So unless you're prone to UTIs, flu symptoms typically are just the flu. But if you have had UTIs previously, and you're familiar with that, absolutely go get that checked out.
Perfect. Mm-hmm. And then the last comment, the first comment, the person replied again, and they suggested gargling. The doctor said 2 times per day.
Morning and evening it is. Or however it fits you best. Okay. So flu care at home. You can treat mild flu symptoms at home. And here's some self-care tips. Get plenty of rest. Okay. We're all very, very busy. And the idea of bed rest is kind of difficult for us sometimes, right? Especially when we're caregiving to other people. If we're not well, we can't keep the other people that we're caring for well either. And the flu is fairly contagious, so we want to try and keep away from other people so that we don't pass that along. The more rest you get, the better care you'll be able to provide to others. So that's really, really important. Take the over-the-counter payment. I'm sorry, I'm having issues here. Taking over-the-counter medication such as aspirin, ibuprofen, or Tylenol, or acetaminophen. Please ask your doctor for any alternatives if you're allergic to any of these medications. Pregnant women should not take ibuprofen, and children should not take aspirin. However, you may be on a different kind of blood thinner for your disease process, So always check with your doctor as to what would be the best pain medication to take, even if you are just taking over the counter. Drink plenty of fluids, especially water, soups, drinks with electrolytes. Gatorade is fine. Sometimes it can be annoyingly sweet and can cause some nausea. So you can dilute that with a little bit of water and that will definitely help. There are a lot of electrolyte packets you can now buy that have very small amounts of sugar in. Pedialyte is a really good alternative to one of those things. So anything that's going to replenish what we're losing by sweating or vomiting or having diarrhea is always a good thing. It'll keep your strength up. Little sips are important. Try not to like take big gulps because it's going to be heavy on your body. And while it's fighting an infection, it can cause more difficulty in the absorption. So we want to take small sips, let that absorb, and and do it frequently and hydrate. So keep a track of the number of cups of fluids you take in a day. Try to get to 8 to 10. Take an antiviral medication if your doctor prescribes it. That's definitely not something that you're going to get over the counter, and your physician will want to know how long your symptoms have been going on. Based on those, the length of time and the symptoms that you're expressing to them, they will determine whether this is the correct medication for you. Move on. Any questions before we move on? No? Okay. So moving on to COVID-19. People with COVID-19 have had a wide range of symptoms, ranging from mild to very severe symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. Older adults and people who have severe underlying medical conditions like heart disease or have COPD, lung disease, or diabetes seem to be at a higher risk of developing more serious complications from this particular disease. People with these symptoms, sorry. Hello. Oh, Kristen, I'm lost. I'm sorry.
Okay, if you just, there you go.
I have a weird square thing on my screen. Do you see it?
It's fading. Just ignore it.
Okay. If someone is showing any of these signs, seek emergency medical care immediately. Any trouble breathing, persistent pain or pressure in the chest. It could be COVID related, it could be heart attack, it could be a number of things. So we always want to seek treatment when it comes to any kind of persistent pain or pressure to the chest. New onset of confusion, very much like when you have the flu and it has a similar symptoms to a UTI. Confusion that is a new onset could be due to the fact that you're not getting enough oxygen. It could be that you have another infection going on. Inability to awake or stay awake, bluish lips to the face or to the lips. This is not all the listings that we have, but these are some of the most common ones that we come across. And so if you are having any of these symptoms, please seek out medical help. Go call 911 or call your physician. Do whatever you feel like you need to do to get seen. Steps to help prevent the spread of COVID-19 if you are sick. If you are sick with COVID-19 or you think you might have COVID-19, help protect others in your home and in the community. For starters, we really don't want to leave the home. Most people with COVID-19 have mild illnesses and they can recover at home without medical care. Do not leave your home except for to get medical care if you need to, and do not visit public areas. We, I think, as a group, as a whole, we fight through everything. We get a cold, or well, we just have to push through, and we have to just go to the grocery store. We've got to take care of this, and we've got to take care of that, and we've got to run over here, and we've got to run over there. But this is very serious, right? We don't want to expose anybody else to it. If we know that we have COVID-19, or if we have symptoms that tell us that we may have COVID-19, we certainly don't want to spread that to anybody else. So we want to make sure that we stay quarantined in our home. We want to make sure that we don't go out into the public. We want to make sure that we or away from even our family members, right? We don't want to spread it to the rest of our families. Someone somewhere has to kind of help try to take care of us, and we don't want to have the whole household be sick at the same time. It can be very difficult. Taking care of yourself is so important. Again, the same applies. You want to get rest and you want to stay hydrated. Take over-the-counter medications as you are allowed, such as the Tylenol, to help you feel better. Stay in touch with your doctor. Call before you get medical care. So a lot of the times, if you're feeling that your breathing is getting worse and you're feeling that this might become an emergency, you want to try and call ahead to the hospital to let them know, hey, you know what, I think I have COVID, my breathing is getting more difficult, I'm going to be coming. If you're coming by ambulance, well, they'll call ahead, but if you're going to go by car, you might want to let them know what kind of car that you're driving so they can keep a lookout for you. Any questions, thoughts, or concerns? Kristen, if you're speaking, you're muted, my dear. I can't hear you.
Thank you. There was a comment that said, how to decide when to get tested if you are unsure if it's the flu or COVID? How do you decide that?
Really, the conversation has to happen with your physician, and they will advise you whether it's severe enough or whether it looks like COVID and you need to go and get tested. It's usually the best way to go. A lot of people, if they're working in the healthcare field, they are being tested routinely through work. And they might be able to give them a better idea. If you are unsure, please contact your physician first. One of the things you don't want to do is if you think you have COVID-19, again, if we're trying to protect the rest of the public out there, we want to make sure that we've called ahead and let somebody know that we're going to be coming to be tested. So that's one of the reasons you want to reach out to your physician first.
That's it.
We want to avoid public transportation or ride sharing or taxis, right? Because even though we're wearing masks, some people are more susceptible to getting this disease faster than others. Separate yourself from other people, mostly in the home. If you're in the home, you want to try and quarantine yourself to your room. And there's a lot of wonderful information that the CDC website has, and they make it really, really easy for you to understand how often you should clean in your area, who should be doing the cleaning, how often you should do your laundry, what precautions to take in the home so that the whole household is still able to function normally and be safe while one person is quarantined because they are sick. As much as possible, stay in a specific room and away from other people and pets in your home because pets are susceptible and can also transmit. Use separate bathrooms. If you need to be around other people or animals or outside of the home, wear your cloth face covering. Caring for someone who is sick at home, the caregiver, when possible, should not be someone who is at high risk for severe illness. Use a separate bedroom and a bathroom. If possible, have the person who is sick stay in their own sick room or area away from others. Try to stay at least 6 feet away from the person who is sick. And if you have to share the space, make sure that make sure the room has good airflow. So open your windows and turn on a fan if possible to increase air circulation. Opening windows is usually easier. Sometimes the fan can cause a bit of a disruption. Really, if you can do both, it's really a good idea. It circulates the air better, it clears the air, and it prevents anything settling and being in a one big clump in one area. Avoid having visitors, okay? Questions, thoughts, or concerns?
We did have one comment, and it said, I contacted my doctor online, described my symptoms, and he was able to refer me, he was able to refer without a visit.
Perfect. Thank you for that. As far as eating goes, we usually do this as a community, right? Families sit together. We all eat together when we have an infection of any kind anymore, but especially when we have COVID. We want to make sure that we're eating in separate rooms or separate areas. We want to stay segregated. People who are sick should eat together. If there's more than one person in the home that is sick, or if they need to be fed, then that the sick person can feed the person that is not able to feed themselves in their own rooms if at all possible. Washing dishes and utensils, please use gloves and hot water. Handle any dishes, cups, glasses, or silverware used by the person who is sick with gloves. Clean hands after taking off gloves and handling used items. It's always good to wash your hands. Soap and water, good friction. Almost like a surgeon, you just want to run it under the tap and let the water flow. Just shake gently and then use a paper towel to dry your hands. Avoid sharing personal items. Do not share dishes, cups, glasses, silverware, towels, bedding, or electronic devices, especially the phone, which is going to be very close to your face typically, with the person who is sick. Wear a cloth face covering and gloves at all times when providing care. Any thoughts, concerns before we move on? No. Okay. So here's a lovely little diagram that reminds us all of the safety precautions we've been taking. We want to stay 6 feet apart, which is 2 arm lengths. We want to cover our coughs, which we should always do. If you don't have a tissue available, by all means, I always pick up my sweater and go into my armpit and to the elbow of my arm. But so long it's not getting out anywhere. When we are in public, we should always be wearing a mask. And it shouldn't be a mask that does this, but a mask that covers the nose and our mouth with droplets from both areas. Avoiding touching your eyes and
Karen, we can't hear you for some reason.
I'm sorry, I stopped just because there was a lot of noise in the background. I thought I'd give it a minute.
Oh, okay.
Waleed, Abraham. Yes.
Okay, well, I'll just clean and disinfect frequently. Frequently touched objects and surfaces.
You know what?
Be home when you are sick, except for when you need to get medical care. Wash your hands often and with soap and water for at least 20 seconds. And
that one, that one they canceled the COVID test. The reason being because they weren't going to get the test on time. So they were going to do it tomorrow at the hospital.
I'm just going to.
Okay, Karen, can you unmute yourself if you hover onto your left screen? I'm sorry about that, guys. There's a few people that have joined, and it looks like somebody doesn't know that their mic was on, so I had to mute everyone to get started again. So, Karen, you should be fine now.
Thank you. Thanks. Wearing a mask over your nose and your mouth. Masks help prevent you from getting or spreading the virus. Everyone should wear a mask in public settings and when around people who don't live in your household, especially when we're doing other social distancing measures with difficult to maintain. So if we are in a meeting or in closed encounters, we really want to make sure that we're wearing masks because we can't keep that 6 feet distance, which we should try to do to the best of our abilities, but at certain times those things are unavoidable. Masks should not be placed on young children under the age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Please do not use a mask meant for healthcare workers. Masks meant for healthcare workers are meant for healthcare workers, specifically because we work very, very closely with patients that are at risk or have COVID, and we have to break that 6-foot barrier all of the time. If we're keeping our social distancing, any kind of fabric face covering is recommended, and it has been proven to be safe for everyday use. When I'm not working, I am not wearing a surgical mask. I wear my fabric mask, and I certainly don't wear one that is an N95. So please, let's be mindful of that so that we don't utilize things that are meant for healthcare workers. A mask is not suitable for social distancing. excuse me, a mask is not a substitute for social distancing. Simply because it is the barrier, right? I mean, certainly we can social distance, but droplets fly everywhere, and we want to make sure that we are protecting ourselves and everybody else by having a barrier between ourselves and everybody else around us. Not working.
You did have, Kieran, you did have a comment on that as well. So somebody said that they agree about the proper way to wear a mask. Somebody could talk about that, because we see so many people that don't wear a mask over their nose. It might be below their nose. So maybe you could share about the proper way to wear a mask.
Absolutely, certainly. Any type of mask that we choose to wear, most of them have loops, just like this. We want to put that over our ears, and then we pinch above the nose and tuck right underneath our chin. It is now known that our nose is the appendage that should not be showing, and it is the dirty word that's out there where, you know, it's supposed to be kept private now. The reason that we want to cover our nose is we have droplets in our nose and we have droplets in our mouth, and if we expose either one of them, we are spreading those droplets out and spreading the virus. So we want to make sure that both areas are covered. It doesn't have to be so tight that it's pinching your nose and it's closing off your nasal passages, but it needs to be tight enough where you are not feeling the air that's coming up into your eyes. Okay, does that help? I hope that helps. Anytime you touch your face, every time you readjust your mask, most likely you have some kind of contaminant on your mask. So you want to make sure that you have your hand sanitizer close by and you want to wash your hands. Okay. That way you're less susceptible to rubbing your eyes or doing something else with dirty hands, and then you won't get sick. I'm an eye rubber and I'm a face toucher. This has been quite a difficult task for me. So I'm working on it, and I have my hand sanitizer right next to me all the time too. Staying 6 feet away inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet distance between the person who is sick and other household members. Outside of our home, put 6 feet distance between yourself and others. Remember that some people without symptoms may be able to spread the virus. And more we are finding that there are many people who do not get sick, but are carriers of this disease. And just because they don't appear sick or they don't have the symptoms like normal other people have, doesn't mean that you can't get sick from them. So just keeping that in mind, you want to just make sure that you take the best precautions for yourself. So 6 feet apart, masks always in place.
Actually a couple of comments.
Yeah.
Somebody asked, what about plexiglass shields around the face with no mask?
So a shield without a mask has not yet been proven that that is as efficient as wearing a mask and a shield. Although I know I've seen a lot of commercials that come across that show this wonderful idea of having that. What has been proven is that the mask really truly works. Unless that shield covers and has a foam that preventing anything from falling down, and then goes right around the side of your head, behind your ears and underneath and tucks under, I can't see that there's no way for it to, the air to blow it into your face and for you to breathe it in. And that's the whole point, is that you're going to be breathing in those droplets. So I'm sure there's a lot of new innovations coming out, and I always wait for the evidence to show that that has been proven to work effectively.
Okay, thank you. There's one additional question, but I think
Sure.
you addressed part of it on another slide, so I'll come back to it as you continue.
Okay, certainly. Keeping distances from others is especially important. People who are at higher risk of getting very sick. I have to keep a big difference between my mother-in-law. She is 90 years old, and she has heart disease. So I, wear a mask. I wash my hands. I have to prepare foods for her. I often bathe her. Keeping you know, all those intimate things that we do for people that we care for really requires us to be extra vigilant in making sure that we keep them safe as well as ourselves. We want to always avoid crowds and poorly ventilated areas. If we happen to be in a room with lots of people, we want to try and make sure that the windows are open or the doors are open or the fan is going. Being in crowds puts you at a higher risk for COVID-19. Avoid indoor spaces that do not offer fresh air from the outside as much as possible. And again, sometimes it's unavoidable, but the least amount of time we spend there, the better. Washing your hands. Wash your hands often with soap and water, at least for 20 seconds, okay? That's singing happy birthday twice. It's especially important to wash before eating or preparing food, before touching your face. So if you don't have soap and water nearby, certainly use your hand sanitizer. And you're going to use at least a dime size for your hand. It should make your hands nice and wet, and you're going to rub until they're dry. Shaking is not a good idea. To dry them, you really want to continue to vigorously rub until they are completely dry. After using the bathroom, leaving a public place, after blowing your nose or coughing or sneezing, after handling your mask, after changing a diaper, after caring for someone who is sick, after touching animals or pets. It seems like common sense, but not everybody remembers to do it. Sometimes we touch something and we forget because we're in the middle of a conversation or we've moved on to do some other task. And so we want to always be very mindful that these are important times to wash our hands. If soap and water are not readily available to use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands.
Okay, Karen, I think this is appropriate time for that next question. So somebody said that they heard that it's important when using hand sanitizer to use it for the same length of time as if you were washing your hands. Example, 2 rounds of the happy birthday song. Is that correct?
That is absolutely correct. Actually, that's a very good comment. Thank you.
Perfect. And then there's another one. How often can I reuse a surgical mask? Or should I reuse a surgical mask?
So we use the same surgical mask all day long unless we feel that we are in a environment that we think is contaminated, and we might switch it out. But if you are in your home and the environment hasn't changed very much, you can use the same surgical mask for that day.
So a single day and not multiple days.
Correct.
Correct. Thank you for that.
Of course, if it's contaminated, if it gets wet, I mean, I should put those little things in there. If you think it's dirty or soiled in any way, then absolutely switch it out. But if it's clean and you haven't been messing with it, nothing's on it that you're aware of, you can reuse that mask for that whole day. And I'm going to keep playing with mine. I'm sorry, it's a little tighter than it usually is, and it keeps pulling down. Covering your coughs and your sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Do not spit. Throw your used tissue into the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with hand sanitizer that contains at least 60% of alcohol. And of course, as we talked about before, most people keep a handkerchief or a tissue around, but sometimes you used up your tissues or your handkerchief and you have to sneeze. To avoid using your hands, definitely use the pit of your arm or the elbow area of your arm so that you're not contaminating other areas. Clean and disinfect. Do it frequently, especially on frequently touched surfaces, right? So if you're in the office, your frequently touched areas is certainly going to be your mouse, your phone, your computer, your keyboard, your desktop. If you have doors that you keep closed for Zoom meetings like this, then you're going to use the door often. So your doorknobs, your light switches, anything like that, you want to make sure that you are wiping down frequently. After you wash your dishes, sanitize your sink, your faucet, your countertops at the end of the day. And after you've finished preparing food, after you've finished putting the dirty dishes away, after you've eaten, it's always a good idea to clean that surface area. So any place that you use often, bathroom, toilet, those need to be cleaned after you have used them. Oh, did I finish that? I don't think I did. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. And they say the reason that you use soap and water is that you get most of the dirt and you get most of the contaminants off, and then whatever is remaining, you clean and you kill with the disinfectant. And you may use any household disinfectant. It can be bleach-based or hydrogen peroxide-based, either way.
So just another comment. There was a tip that was shared, and that said to be sure to always use your own pen with you, or have a pen with you, so that you do not have to use pens in stores and other public places. It's a great tip.
It's a very good tip. Thank you. Monitor your health. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19, especially if you're running essential errands. If you're going to be going into the office or to the workplace in settings where it may be difficult to keep a physical distance from people that is 6 feet apart. Always wear your facial covering. Use CDC's self-checker tool to help you to make decisions about seeking appropriate medical care. If you have trouble breathing, like really trouble breathing, then please call 911. Call your doctor or emergency room and let them know that what your symptoms are before you go in, and they will tell you what to do. Are we good to move on? Okay. Caring for someone sick at home or other healthcare or a non-healthcare setting. So a home can look like anything, right? Provide support and help cover basic needs. Usually some place to keep warm, a place to clean up and go to the bathroom, and provide food and a place to wash dishes, right? Help the person who is sick follow the oh dear Lord. Help the person who is sick follow the doctor's instructions for care and medicine. For most people, symptoms last only a few days, and people usually feel better after about a week. See if over-the-counter medications help with fever, and see if the person is feeling better. Make sure the person who is sick drinks lots of fluids and gets help and rest. Help them with the grocery shopping, filling prescriptions, and help getting them items that they may need. Consider having the items delivered through a delivery service if possible. Take care of their pets and limit contact between people who are sick and their pets when possible. Pets are very intuitive. When someone is sick, they want to lay by their sides, but sometimes the best thing to do is keep them away. Okay, so here's some ways to protect your health. The flu shot is a safe and effective way to reduce the chance of ending up in the hospital with severe flu. This year, people with flu symptoms were likely to have or to get COVID-19 and stay home from work and isolate, quarantine their families while awaiting their results. And it's tedious having to lock yourself in your home or in your room and not be around the people that you love. So vaccinations, some people believe in them, some people don't, but they've really been proven to be safe and are beneficial to our health. Safe and effective COVID vaccine is one of the most important tools in ending COVID-19 pandemic. So if you have the availability and you get the resources, please, if it's available to you. Most clinics are starting to call and email people, letting them know and be prepared that they will be available to them if they are wanting them. And I say that because CVS reached out to me from my mother-in-law that they don't have it yet, but it's pending, and so they'll let us know when it's available. If you are able to get out and get that, I highly recommend that you do. Any thoughts or comments or questions about that?
Thank you, Karen. No, just one additional comment. They said, you know, the self-checker tool was a great tip.
Mhm.
So thank you for sharing that. Any questions in regards to the vaccinations? You know, I would just recommend that each county is a little bit different in their delivery of this COVID vaccination. The flu vaccination, I believe you can get pretty much anywhere at this time. But for the COVID vaccination, I would check with your local Department of Health. Go on their website and look at the different tiers and what tier that county is in, and what resources they have to find a vaccination site. Or contact your doctor. They should be able to assist you with that as well.
Yes. Thank you, Kristen. And the CDC really does have a lot of wonderful tools to use. So absolutely, if you can go on that website, it's going to be a lot of help to you. Okay, and there are some of our resources.
The Sutter Health website has a lot of great resources in regards to flu resources, as well as information about the coronavirus and vaccination. So I'd encourage you guys to, you can visit the local Sutter sites there, as well as our Stanislaus County Health Services Agency. San Joaquin County has the exact same County Health Services Agency that will have information for those living in San Joaquin County. And then the Center for Disease Control and Prevention. Obviously, most of the information that we shared today came from that website. So lots of great resources for you guys to gather for yourselves and for your families.
Then we have.
So sorry, I'd like to apologize for this really kind of annoying little box that's showing up on our screens. I think some of you can see it there. When we do end our session today, after we take questions and answers, we will stop the recording and you're welcome to depart from the meeting. However, I'm going to keep it up for a little bit so we can troubleshoot why this is showing up. It's having an error on the Zoom platform that our IT department's trying to figure out on the back end. So please excuse this little box that keeps showing up in the middle of the slide. With that, we decided to do this as a meeting so that our participants could ask their own questions as well. So if you have a question or a comment, or you would like to talk to Karen directly, please feel free to unmute yourself and you can go ahead and ask questions to her directly. And Karen, did you have something you wanted to close with?
Not really, but I hope everybody is safe and you use your resources wisely. Caregiving is really difficult, I know, so please take good care of yourselves. It's so important to take time for yourselves and do what you would do for somebody else for yourself, right? Because we're such givers. I know caregivers are always about the other person, but there's no time like the present to take good care of yourself so that you can continue being the best version of yourself. So thank you for all that you do for your loved ones or for the people that you care for. Thank you for joining us today.
Perfect. And at this time, we'll take any questions or comments.
I just want to thank both of you for such a complete and informative presentation. You really covered every area, and I hope that this helps others who need this information. So thank you.
Well, thank you very much.